Welcome to the Cystic Fibrosis Nursing Masterclass. This video will cover the pathophysiology, diagnosis, and management of cystic fibrosis. Let's start with a question. Cystic fibrosis is inherited in which genetic pattern? A. Autosomal dominant, B. Autosomal recessive, C. X-linked recessive, or D. Mitochondrial inheritance. The correct answer is B. Cystic fibrosis is an autosomal recessive disorder caused by mutations in the CFTR gene, requiring 2 mutated copies for disease expression. Next question. What is the gold standard diagnostic test for cystic fibrosis? A. Chest X-ray, B. Sweat chloride test, C. Pulmonary function test, or D. Sputum culture. The correct answer is B. The sweat chloride test is the gold standard. A level greater than 60 MEQL on 2 occasions is diagnostic of cystic fibrosis. Which GI finding is often the earliest sign of cystic fibrosis in newborns? A. Chronic constipation, B. Meconium ileus, C. Gastric ulcers, or D. Pyloric stenosis. The answer is B. Meconium ileus occurs when the meconium is too thick and sticky, causing obstruction at the ileum. This is a classic early sign. What is the primary pathological mechanism of CF? A. Increased fluid secretion, B. Thick, viscous secretions obstructing ducts or passages, C. Excess insulin production, or D. Rapid bone turnover. The correct answer is B. The CFTR protein defect leads to faulty chloride transport, resulting in thick, dehydrated mucus that obstructs multiple tracts. Pancreatic enzymes should be administered. A. Once a day in the morning, B. With every meal and snack, C. Only when the child has abdominal pain, or D. On an empty stomach. The answer is B. Pancreatic enzymes are essential for digestion in CF patients. They must be taken with every meal and snack to ensure adequate nutrient absorption. Which vitamins are most commonly deficient in cystic fibrosis? A. B complex and C. B. Fat-soluble vitamins, A, D, E, K, C. Vitamin B12 and folate, or D. None. The correct answer is B. Due to pancreatic insufficiency, fat absorption is severely impaired, leading to deficiencies in fat-soluble vitamins, which require supplementation. Which diet is recommended for a child with cystic fibrosis? A. Low-fat, low-calorie, B. High-calorie, high-protein, high-fat, C. Low-protein, high-fluid, or D. Strictly liquid diet. The correct answer is B. Children with CF require a high-calorie, high-protein, and high-fat diet to prevent failure to thrive due to increased metabolic demands and malabsorption. What nursing intervention is vital to clear airways in CF? A. Cough suppressant medication, B. Chest physiotherapy and postural drainage, C. Encouraging deep breathing while lying flat, or D. Keeping the patient NPO. The correct answer is B. Airway clearance is a priority in CF management. Chest physiotherapy, postural drainage, and breathing exercises help mobilize thick bronchial secretions. Which bacteria is frequently cultured in CF patients? A. Escherichia coli, B. Pseudomonas aeruginosa, C. Streptococcus pyogenes, or D. Neisseria meningitidis. The answer is B. Pseudomonas aeruginosa is the most common pathogen in the lungs of CF patients. It leads to chronic infections and progressive lung damage. Which medication is used to reduce mucus viscosity? A. Dornase alpha, B. Furosemide, C. Insulin, or D. Digoxin. The correct answer is A. Dornase alpha, or pomozyme, is a mucolytic that breaks down DNA in the mucus, making it thinner and easier to clear from the airways. Which chronic clinical sign is seen in older CF children? A. Finger clubbing, B. Tachycardia, C. Hypotension, or D. Alopecia. The correct answer is A. Chronic hypoxia from persistent pulmonary infections leads to finger clubbing, a common sign in advanced CF. What risk does CF pose regarding blood glucose? A. Hypoglycemia, B. CF-related diabetes mellitus, C. Diabetes insipidus, or D. Normal blood sugar levels. The answer is B. Fibrosis of the pancreas can damage islet cells, leading to carbon monofluoride-related diabetes mellitus, which requires glucose monitoring and possibly insulin therapy. What is a common complication of meconium ileus in CF? A. Bowel perforation, B. Excess weight gain, C. Normal digestion, or D. Respiratory relief. The correct answer is A. Untreated meconium ileus causes total obstruction, potentially leading to bowel distension, volvulus, or intestinal perforation. Exercise is recommended for CF patients because A. It prevents muscle loss. B. It helps mobilize secretions. C. It increases cardiovascular endurance. Or D. All of the above. The correct answer is D. Aerobic exercise is beneficial for CF patients as it promotes airway clearance, improves muscle strength, and enhances cardiorespiratory fitness. What characterizes CF sweat? A. High glucose content. B. High chloride and sodium content. C. High protein content. Or D. Low salt levels. The correct answer is B. CF patients have dysfunctional chloride reabsorption in sweat ducts, resulting in sweat with very high concentrations of salt. Next question. What is the inheritance probability for a child if both parents are carriers? A. 0%, B. 25%, C. 50%, or D. 100%. The correct answer is B. In autosomal recessive inheritance with two carrier parents, there is a 25% chance per pregnancy that the child will inherit the disorder. Which symptom is indicative of pancreatic insufficiency in CF? A. Steatorrhea, B. Dark, tarry stools, C. Frequent watery diarrhea, or D. Normal stooling patterns. The correct answer is A. Lack of pancreatic enzymes leads to fat malabsorption, causing large, greasy, and foul-smelling stools known as steatorrhea. The CFTR gene is located on which chromosome? A. Chromosome 7, B. Chromosome 21, C. Chromosome 11, or D. X chromosome. The correct answer is A. The gene that encodes the CFTR protein is located on the long arm of chromosome 7. Nursing management of a CF patient includes A. Monitoring growth charts, B. Assessing respiratory effort, C. Providing psychological support, or D. All of the above. The correct answer is D. Holistic care for CF involves monitoring growth, respiratory status, and offering emotional support to manage the chronic life-shortening illness. When is the sweat test usually performed? A. Before 24 hours of life, B. After 48 hours of life, C. At 1 year of age, or D. Only in teenagers. The correct answer is B. A sweat test is generally not recommended before 48 hours of life because neonates often have inadequate sweat production for a reliable result. Rectal prolapse in CF is associated with A. Chronic coughing and bulky stools, B. High protein intake, C. Excessive exercise, or D. Normal bowel habits. The correct answer is A. Chronic forceful coughing, combined with malnutrition and bulky stools, can increase intra-abdominal pressure leading to rectal prolapse. Pulmonary complications may include A. Pneumothorax, B. Hemoptysis, C. Cor pulmonale, or D. All of the above. The correct answer is D. Extensive lung damage in CF can lead to pneumothorax, hemoptysis, and cor pulmonale due to chronic lung disease.